Hello and welcome. Welcome everyone who's listening. And I'm here with Rachel. This is Harmoniously podcast. And today we're going to talk about ketamine.
Hi, everyone. I'm Rachel, as Melissa introduced. So I guess I'll start a little bit with just my background and why I think we should talk about this. But
Yes,
I've
please.
actually I've been in medicine probably coming up on 20 years. I started off as a nurse. I worked in critical care in a neuro intensive critical care and emergency room for about 10 years, and I actually moved into more of a family practice and kind of a traditional role. I worked in a lot of women's health settings, and I actually found that over some time I grew really frustrated. This was just pre-COVID, that so many of our mental health symptoms relate to our physical health symptoms, and I was only able
Mm,
to treat one. And I had seen this kind of growing community in psychedelics, and I knew what they had done for me personally, and I was pretty sure of what they could do professionally for many. So I bridged the gap and I made the jump into psychedelics about 3 years ago, and I've never looked back. And I am completely immersed in psychedelic culture as far as like from a medical standpoint. But I did have some personal experience with them that really kind of helped, I think, shed light on how useful they could be. But I've been working typically in ketamine specifically, only because it is pretty much the only legal psychedelic we have, at least in the US right now. I know we're making some good improvements in other areas, but for now. And I also think it's also a very effective treatment for PTSD, anxiety, and depression, which so many of
mhm.
us are dealing with, especially with COVID and post-COVID days and the world climate. So, yeah.
Okay, that's amazing. And we also need to say like that Rachel is part of the team here in Harmoniously. And so
Right.
what
That's
is
right.
your role in Harmoniously? You forgot that.
I did forget the last part. Yes. Chronology. So yes, and I am now working with Harmoniously, partnered. I'm one of the founders. I'm also the chief clinical operator. So we do all of the other kind of chief clinical operations, overseeing kind of making sure that everything's working the way it should from a medical standpoint. And I couldn't be happier to be here.
That's amazing. Yes, here in Harmoniously, we are really creating like we already have a beautiful team, but we're creating like a new way to approach well-being for everyone. So we really see we all are in alignment,
Mm.
and we see the person as a whole, which what it should be. But funny
Yeah.
enough, hasn't been seen that way so far as a whole individual, and we don't want just to treat the symptoms, but actually to see the person and support them to reach full well-being. So, but let's start with ketamine, which is what we're offering right now. It's the
Yeah.
first thing that we're offering. We're starting up with ketamine. So,
Yeah.
what is ketamine? Why ketamine?
Yeah.
And just explain like as if I didn't know anything.
Yeah. So we're offering, unconventional treatments, but I hate that word because I don't believe in conventional treatments either. But we're using an at-home model. So this is typically ketamine is delivered in many forms. It can be obviously IV, it can be IM, intramuscular injections, it can be
Mm,
nasal spray, it can also
mm,
be oral tablets. So there's so many different forms of ketamine. In this setting, we're offering usually rapid dissolving or troche based forms. So they are oral formulations for at-home clients to enjoy.
mhm.
So there's, I think, a dual benefit to ketamine treatment, and one is the experiential benefit, and one is simply just the neurobiological benefits that we get from ketamine. In the home setting, this is really designed for lower risk patients. It's been proven through several studies and many other, former giants in the industry that this is a safe model.
Mm.
Um, Ketamine is actually a really safe medication, and as a little fact, I've used it on kids as little as 2 in the ER. So it's
Oh,
a very
really?
safe medicine. It's a lovely sedative and anesthetic is how most people are familiar with it. It's typically used as an anesthesia
Mm,
medication, and that's how it was developed in the late 60s, 70s. Um,
mhm,
However, the way that we're using ketamine here is usually based on a symptomology. So patients might have symptoms of depression, uh, anxiety, generalized anxiety. And I see that it works quite well in our PTSD, and that includes complex PTSD.
Hmm.
I think that we use it as an off label use for these types of conditions, and the efficacy I've seen with it, and I've prescribed classic antidepressants and other types of medications for mental health for 10 years. I've never seen anything be this effective. And I always hesitate to say that because I don't want anyone to feel like this is some magic pill or like some silver wand they're going to wave and their life's going to be better. But I think it's because I like to structure this in like the way that we think about it as a tool in our tool shed to access those
Hmm.
things. It's not the medicine's not making us better. We're making us better and we're using medicine to access that. And I think
Hmm.
when we frame it that way, we see better outcomes as well.
Yeah.
But what is ketamine? So it's a pretty interesting medication. It has a couple of like really key features. And I'm going to try not to get super nerdy about it because I love like all the nerdy brain stuff. But the way I usually describe it is like it has four areas like in its mechanism of action that are kind of key
Hmm.
features that I think relate to the way patients get symptom relief. Um, Ketamine works in part of our limbic system in our brain. Really, what it does is that it works in a glutamate pathway. So
Hmm.
glutamate we could think of as kind of one of the big boss chemical messengers in our brain. It oversees a lot. So with ketamine on board, we get some kind of inhibitory and some excitatory functions in our brain that it kind of helps us with. We could compare that to like classic psychedelics, like other psychedelics primarily focus in a serotonin based system in our brain, and all the other antidepressants that we use, like they all
Hmm.
work with a serotonin dominant system, which I think is, why we see some impact on anxiety and depression in some folks, but we don't see it in everyone. Ketamine works differently, like in its entirety. It works in glutamate, so it has some serotonin impact. But technically, when we're getting this little rush of glutamate, we basically get a little neurochemistry resetting. So some of the things that are a little off, or maybe a little genetically impaired or stress related that are off, kind of get a little rebalancing. I think that's one part why patients start to see some improvement in their symptoms is our neurochemistry is a little bit better balanced.
Hmm.
And the second thing I think it does remarkably well is it does help with kind of this surge of intracerebral BDNF protein. But all BDNF protein really is responsible for in this context is that it helps our synapses reach out and start creating new neural networks.
Hmm.
And this is kind of that huge concept of like neuroplasticity. This is where we start to see development of insight and development of perspective and the ability to kind of make sense and meaning of things. I often use like an analogy in this place, like about how most of us are kind of operating in really deeply ingrained circuits in our nervous system. A lot of us follow this kind of hypervigilant or kind of intrusive thoughts and like more sympathetic driven states. But our sympathetic nervous system is finite and has finite resources. So we start to kind of burn out and we might withdraw more and we might have more depressive thoughts. We might have some trouble with sleep. We might isolate more. And then
Hmm.
eventually this will kick on anxiety again because now we haven't gotten that thing done or we missed a day of work. But these circuits have been given positive feedback for a really long time and they're deeply ingrained in our nervous system. But if we have
Hmm.
all these new resources now, we can start to kind of break out of old patterns and develop new templates in our brain that can be more resourceful. The
That's
third
so
thing
interesting. Okay, go
yeah, it's
ahead.
fascinating, right? Like, and I think that's
Yeah.
what we really think about when we see like neuroplasticity. Like, it's
Yeah.
actually kind of hard to tap into as like an adult brain. Like, if you have kiddos, like you can see like when they're going through that really rapid phase of
Hmm.
neuroplasticity, like it's when they're learning how to like crawl and then walk and then run, and they do it in such a fast time period. That's really neuroplasticity at its
Yeah.
best.
And this last part makes it really clear how it's important to have a therapy or a coach, and how you
Yes.
said it's a tool in the toolbox, because so this tool help us, but then it's on us to, with a coach, with a therapist,
Yeah.
then create that.
Yeah.
So we have we have this, let's say, give, I mean, this tool give us this
Yeah.
opportunity to create new patterns, but we need to create them.
Totally. And I think that's one of the most important features is like we're upgrading the operating system of our brain. And and that's my metaphor I use. But like when we do that, we have to be quite thoughtful about the templates we're installing, which is why it's so
Yeah.
important to like pair this with coaching or, psychotherapy,
Mm-hmm.
and also just really, healthier resources for our brain. We're placing our brain in a really amenable state to learning new information. And when we
Mm-hmm.
do that, like it bodes well to be thoughtful about what we place
Yeah.
there as templates. Um,
Exactly. If we know, don't, I mean, we do not know any better. And after treatment, and
yeah.
then the only thing we know is what we were doing before, then we're going to recreate the same pattern. And
Yes.
that's why, like, with coaching, therapy, and again, like in Harmoniously, we are building like all
Yeah.
different like support or offerings like meditation, in that you can also look for those
Yeah.
things outside: meditation, yoga, whatever excites you,
Right.
so that in this way you have
Yeah.
a you're cleaning your canva and you can
Mm.
start painting a new
Yeah.
paint for your life.
I love that analogy. That works really well here. Yes, I think that's exactly what it is, because we all come with like a programming kind of a detail in our brain, right? Like things we've heard as a from society, from parents,
Hmm.
from other contexts, and like those are those voices we used to talk to ourselves with, and we want to upgrade some of those. We want to like include new messages. And I think even the painting bodes well too, because it's in like art in general is one of those ways that we drop into our parasympathetic system where we rest and digest information. And like that's
Hmm.
an important part of this, is being able to kind of process what's come before now and our experiences, but also in life. I think that that's one of those areas that this tends to see quite a big change in patients. It's where they feel a lot of difference. It makes sense though, right? Like we can learn
Hmm.
information better. And the third thing I think it does really well, I've actually watched live brain mapping during like prior
Hmm.
to ketamine treatment and during, and it's like fascinating what happens to all the brain waves and the
Hmm.
areas of brain. So what we know is that, when we have chronic depression, chronic stress or anxiety, there are regions of our brain that actually kind of start to go offline, like our learning and our memory centers, which might also describe why some patients with depression and even anxiety end up with more kind of brain fog and confusion. It's harder to kind of get information out. We're moving slower. That's
Hmm.
because those regions of our brain are slowing down. They're
Hmm.
conserving resources.
Hmm.
So with ketamine, what happens over some time is that those learning and memory centers kind of are re-recruited. They're back online, but not just that. It's almost like our brain regions all start to globally communicate better. So like our brain's working more effectively in its communication centers. So like every region is starting to communicate more effectively. This makes obviously processing information a little bit easier, reprocessing maybe difficult things we've been through, traumas, etc. So like our psychotherapy tends to be improved. Like we're able
Hmm.
to engage more, we're able to accomplish more, we're able to kind of remove some of those old barriers or blockages that might be there. So it tends to be more effective. And the fourth thing I think it does really well that we kind of scientifically know is not neurobiological category, is that it actually works in, and at least in this context, the default mode network. We could think of the default mode network, at least in this space, as some of the voice we use to talk to ourselves with. Not the nice one, the other one. The guy who's always like, oh, you can't get out of bed, or you're always late, or the one that's
Yeah.
kind of like hypercritical. I think we all
Yeah.
have
The
one of those,
critic.
right? Yeah, that critic. That area we've shown over time has actually quite hyperactive in those with chronic stress, anxiety, and depression. And that area
Hmm.
actually gets some suppression. So now we have a little bit of relief from that guy. And when we put all these things together, right? So we have increased global communication, we have kind of a little bit of neurochemistry resetting, we have this quieting of default mode, we have new neuroplasticity on board. What I find that is that patients start to notice that they have a little bit more space. They're not drowning in symptoms anymore. And when we have even just a little bit of space, we typically can cultivate more space. We start to work through the things that are present here still, like some of those root origin things. And then we start to be able to apply ourselves because our motivation improves in the ways that can be really beneficial, like the things
Hmm.
we were talking about, right? Engaging in all of these other types of, perhaps coaching, exploring spirituality, right? Which
Hmm.
is something, one of our tenants here at Harmoniously. working through, health coaching, or kind of working through maybe some executive coaching with like the way we are at work, who we are with
Mm-hmm.
purpose. So I think that it kind of lends itself to all of those modalities.
Mm. Yeah, for sure. That also help. Not only there's new neuroplasticity, a blank canvas, but also like the critics not talking much anymore.
Yeah.
So
Yeah.
it,
We quiet that guy down a little bit, which is so helpful for most of us because I think, despite oftentimes with our symptoms, like when we really truly have generalized anxiety or major depressive disorders or treatment resistant depression or traumas, I think the most frustrating part for most of us is like we can't think our way out of it, right? Like we
Mhm,
we we can think of all these things that might be so useful and you can think about them, but the motivation isn't there, right?
mhm,
We can't act on them. And I think one of the areas I see this playing into with ketamine treatment is that we do get a bit of this amygdala suppression. And we could think of our amygdala like our kid brain, our kind of irrational brain, our like reactive brain, which I know a lot of us struggle with, like our reactivity. That's because our amygdala is in charge. But our prefrontal cortex is like our rational brain, right? The one that's like thinking straight. And this is the one that's like trying to think you out of depression and anxiety or traumas. And unfortunately, our amygdala is often governing that. And that guy wins every time. So
mm,
when we kind of move through the process of ketamine treatments, we can almost start exploring better communication between these two guys. And they start to develop some traction between their communication. And I see that show up like in real life as like Viktor Frankl is one of my has some absolutely beautiful quotes, but I'll butcher
mhm,
it if I try to say it. But it's basically talking about the space between. So between stimulus and response, there is a space. And I love
mm,
the idea of that space because that's where we have a choice to do something different. And
mhm.
it's almost like that space slows down for us when we start to have all these kind of neurobiological benefits on board. And that's really where I find a lot of people can find agency, right? And agency is such a huge part of us kind of finding identity and purpose and making more meaning from life, I think.
Mhm. Yeah, that sounds really helpful to,
Yeah.
like as you said, like you have that space and be able to choose, make a choice, a conscious choice
Yeah.
on whatever you want to do in your life, how you want to create your life, or yeah, just be able to do a conscious, more conscious choice is such a
Yeah.
gain.
Yeah, definitely. And I think I'm seeing a trend that like overall globally we seem to be kind of coming into a different consciousness and world, and it's
Yes.
showing up in medicine and it's showing up in community. And that's the other part we're trying to kind of build here with Harmoniously is a better community. We want no one heals alone, right? Like
Hmm.
we heal in tribes, we heal in community. And I think the more we heal ourselves, the more we heal each other as well. So like it's focusing on doing this work because this work absolutely fosters all of this work, right? It heals all of this as well. So
Hmm.
I love that kind of perspective when I think about like the healing journey for most of us as humans here on this time and space. I also find it super frustrating that it's a lifelong journey, right? Like healing's not going to end. I think that's sometimes where we get a bit stuck or, narrow minded in it is like, okay, I'm going to complete this chapter of healing and I'm going to be done. And like, nope, it's going to last forever. But there's also
Yeah.
some comfort there, right? There's nowhere to achieve. Like there's no point to reach. It's just becomes part of us always, right? Versus it being like a destination. It just becomes about the journey.
Yeah. I also like to a little bit distinguish in the sense like, okay, healing there is a beginning, a starting point when we
Yeah,
really feel, let's say, broken, or that's the feeling, right? And
sure.
so that's when also healing comes in. And at a certain point, that is the same process as you're saying. It's a lifelong journey. And
Yeah,
I like to call it like growth. At that point, you continue to growth. And even like you will realize that the healing, that healing was like a growth actually.
yeah,
And it's all like all of us growing together. And as I said, like in consciousness, in the universe is growing. So it's still this process of
yeah,
expanding and growth.
yeah,
But I like to distinguish that because at the beginning it's important to
yeah,
focus and feel that okay, you need to heal because you
yeah.
feel unwell. So you
You're
want to
right.
heal. But at a certain point you can be fixated with the idea of healing and still looking for what's wrong with you. And so understanding that no, it's a process, and it's the same process that will continue for like your all your
Yeah.
life. But there is nothing broken with you or wrong. Definitely nothing wrong with you. You're
Yeah,
just expanding and growing and learning, and
totally. Yeah.
that's the beauty of life.
I think that always, like, it's the way I think about integration too, right?
Hmm.
Like, I think integration, we talk so much about that with like psychedelic work and
Yes.
working in that space. And I think it's such an important component. I think it can take kind of part of that, like what might be more nebulous or abstract or subconscious, and almost allows it to become more tangible, like
Hmm.
more, like we can develop more lifestyle and behavioral changes when we have this kind of translation between the two. And I think that's
Yes.
what integration really embodies. But I also
Yeah.
think about integration as like not just with psychedelics, because part of the bigger picture is that we're actually integrating all the versions of self, right? So
Hmm.
all the things that we've been, all the places, all the experiences, maybe the traumas, the relationships, the things we got and didn't get, we're integrating that in the bigger picture into like this whole being, right? And that, I think, really for me is this beautiful metaphor of healing for me. Like that is the integration of like becoming this whole being
Hmm.
rather than these like fractured pieces of self.
Yes,
It's like we get to
exactly.
become this whole. And I think that's one of those beautiful like ways I think about healing. And it helps me also see that it's not a destination in some ways.
Exactly. Yeah, I love that. Exactly. It's integrating all the parts of yourself.
Yeah.
And yeah, but you told me before that ketamine is very different than other psychedelics.
Hmm.
So, how so? Like
Yeah.
maybe someone who's listening or watching already tried
Yeah.
other psychedelic, or maybe not, maybe just heard about other psychedelics. So what's the difference?
Yeah. And I think it is. It's a very, I mean, and they all have their kind of own
Mm-hmm.
signature, we could say, in some way.
Yes.
But in this case, I think that ketamine is different for a couple of reasons. Yeah, I already mentioned it works in a different neurochemical
Hmm.
process in the brain, so it works in glutamate. But it's different for a few other reasons. It tends to be more of a dissociative type psychedelic, so it's more common to kind of have this sense of the separation of brain and body. We tend to reach the dissociation more readily, which can be
Hmm.
common with other psychedelics. It tends to be pretty pronounced with some of our ketamine treatments. What we
Hmm.
also see is that the duration of the experience tends to be far less. So, as far as like, we could be on a macro journey with psilocybin or LSD or other types of psychedelics, maybe in a recreational setting or elsewhere. They may last hours, right? Like, so we could be 5, 8 hours into an experience. Ayahuasca, obviously, a bit longer.
Hmm.
Um,
Yeah, I
ketamine
bought at
tends
24 hours.
Right. Yeah, you're right. Like, days of experiencing. So, um, with ketamine, we tend to see very brief experiences. So
Hmm.
they generally are, in lower doses, somewhere between 30 to 45 minutes. And in, larger doses, we see somewhere between an hour to maybe 2 hours. They tend to
Hmm.
be pretty brief.
Okay.
So the journeys themselves, the experiences tend to be just more abbreviated. It doesn't mean less is happening. And I think the other distinction is that with a lot of our other types of psychedelics, we still have good control over our mobility and our ability to kind of be autonomous. We might want to explore our environment. Less so with ketamine.
Hmm.
Ketamine has more of a bit of a sedative impact. So it's more often done laying down, kind of in a very introspective space, bed, couch, like laying down at home. Um, I also recommend generally using eye masks or closing our eyes. It tends to be more of an internal journey than it is like interactive with our environment. Um, and I think those are the kind of biggest differences. There's some other nuanced differences between them, but I think those tend to be the standout. So those that have had, lots of great other psychedelic
Hmm.
experience, I think it's wonderful because it helps prepare us for the non-ordinary state, right? That stretch of consciousness. But ketamine does tend to be different for a couple of those reasons.
Hmm.
It also remains safe for a lot of other patients that are currently taking already on antidepressants or other psychiatric
Okay.
medications. The good news is ketamine plays really well with a lot of the other,
Mm.
traditional types of therapies.
Yeah.
Whereas the jury's still kind of sussing out if that's
Mm.
going to be safe with like psilocybin and maybe
Hmm.
some other serotonin dominant medications.
Yeah,
So
that's
that's
really a
kind of,
great news
yeah,
because some of
definitely.
those patients don't really
Yeah,
have any other option, and the medicine are not that they're taking not working, so uh,
definitely.
they can use
Yeah.
ketamine treatment. That's a great
Yeah. And
news.
they don't have to trial coming off of like, a psych regime that they're currently doing well
Hmm.
on. A question I get about that a lot is, can I come off my psych meds during this? Can I use ketamine to come off some of my psychiatric meds? And the answer is always like maybe. Like I've had patients that have successfully come off of their psychiatric medication regimes and done very well. I have had patients come off of them and immediately need to restart because they were working and they were helping, in the background, other things that were going on.
Mm.
I've had patients also have to increase their doses because they were able to start confronting very deep trauma or um, work that needed to be addressed inside and felt a little less like they needed a bit more medication during that time period. So I've kind of had everything all over the map, but I try not to ever, kind of identify ketamine as a great treatment to get off your current medication regime. I've seen people do it. It can be successful. But it's never really something that I would tout it as doing. It's really there to kind of help us do the other work that needs to be done. And then we can kind of figure out where we land with maybe making adjustments in some of our meds. I also tend to follow that rule of like never change too many things at once because then you don't know what's working or what's
Hmm.
effective. So trying to kind of do one thing at a time. But it is kind of
Hmm.
a place I often have like thoughtful consideration about. But it is, I think the testament really is that it's still safe in patients that are on current medication regimes.
Hmm.
Um, and should we talk a little bit about like how the treatment sometimes looks, like what that looks like, what at home?
Yes, yes. I'm also curious because, as you said, it's more dissociative,
Yeah.
right? So you feel less of your body, and
Yes.
some of the other psychedelics makes you feel more of your body. So that would
Yeah.
be a great difference because
Yes.
there's so much going on in the body with
Yeah.
yeah, some other psychedelic. So
Definitely.
yeah, so tell us more how it go and how would look like a treatment, how it would feel like,
Yeah.
and also if there's patients.
Yeah. Yeah. So I'll kind of give like an overview maybe of just like what it looks like,
Hmm.
at least from our lens at Harmoniously, like with at-home ketamine treatment.
Hmm.
I guess it might be important first to mention like who would be like an appropriate candidate for this type of treatment and who maybe needs a different type of treatment.
Hmm.
I think there are good populations we've used this with good efficacy, and those are across the board, like our major depressive disorders, so even with severe symptoms or treatment resistant symptoms. We also find that with our generalized anxiety, it works well, and our post traumatic stress syndromes do quite well. A lot of veterans have gotten some great support from especially the PTSD. Clients I think that are just contraindicated for this type of treatment, especially in the home setting, are anybody with like significant personality disorder, schizophrenia, schizoaffective disorder. We would never want to destabilize someone, especially in the home setting. We'd want to really be doing everything we can to make things better, not worse. Some questionable history of psychosis. So if we've had many episodes of psychosis in the past, usually not a good candidate for psychedelic type, medical treatments.
Hmm.
Also, we tend to see that we have a higher suicidality or risk of suicide when we have multiple attempts in the past. So for
Okay.
those that have had one or two, I would say two attempts in the past, generally speaking, I would want you to have more support to do this. So maybe more in person, or there are lots of providers that do like even in office treatment. So IV treatment, things like that. It would be better served with more support.
Mm.
I guess I should say pregnancy, right? So pregnancy is not a good, safe at home for this type of use condition. Those with dissociative identity disorder, again, kind of falling more into that personality type disorders. And then there are some kind of softer guidelines. Like we generally want to keep, reserve this for the safest, like lower risk patients. So um,
Hmm.
actively sober for at least 6 months. So anybody with drug and alcohol problems, as long as we've been sober for greater than 6 months and you have a good support network, those are generally something we would consider. Less than 6 months, I would want you to wait some more time or consider an option with more support. And the same for anyone who's been hospitalized for mental health related conditions in the last 6 months. It sometimes
Mm-hmm.
indicates that we would need a little bit more support.
Mm-hmm.
So this is kind of designed around keeping our like lowest risk patients who have good support networks already for at home. Um, and obviously there's some age issues too. So, you should be an adult. I even tend to kind of defer to more of a 21-year-old age because of our brain development, say our prefrontal
Mm-hmm.
cortex development. There are case by case basis that's really still appropriate between 18 and 21, but there's definitely something to consider there. And so in general, like if a patient, was coming in and wanted to try this at home, I think the
Mm-hmm.
biggest factors like for success are we want to have a good peer support human. So you have to have like an actual human being who can be present for these sessions with you, and it really is something that you feel safe and supported with, but they're there as a support to you and also for safety. So we want to make sure in case UPS is banging at the door, or something is going on at home, or if you just needed help to go to the restroom, that you're well
Yeah.
supported during your experiences while we're under the influence. So an adult not under the influence that you feel safe and supported with. And then most patients, if they have that type of support and they're good candidates, they would meet with the clinicians here at Harmoniously, and we would, do kind of a risk assessment, making sure we've gone over all the history and all the background, making sure that this is a good, safe candidate. And we generally trial dosing like a dose or two of like lower dose because we want to know that we're tolerating this medicine, we're not having side effects, we're not having adverse events to this, because we can have allergies and other things that this is not ideal. And once we get that information, usually we would meet with a client again and assess how things are going. And then we kind of discuss about dosing. Dosing tends to be very individualized for what the patient's trying to achieve.
Mm-hmm.
I tend to kind of divide it into like psycholytic realms with the medicine. So these tend to be areas that are really good for like psychotherapy we can layer psychotherapy on top of them. You can have your psychotherapist, in a Zoom or remote setting, present during sessions to kind of work on really specific areas. They tend to be really effective in that lower dose profile. And then we kind of have the other end where we have more of that transformational or kind of intense psychedelic type
Mm-hmm.
experiences. And I think both are useful. I think we often almost think more is more, but it definitely is not. So there are times we should pull back and there are times we should move forward.
Mm-hmm. Yeah, you can definitely you can definitely have both experience not at the same time, but like plan out a treatment that includes both kind of treatments,
Yeah.
both kind of sessions.
Yeah. And I even recommend that to people sometimes to kind of sometimes enjoy like that meditative or trance state in that lower dose, as well as sometimes it's useful for like a specific processing because we still have quite a bit
Mm-hmm.
of narrative on board, so you can be more focused, right? We're still driving the bus. And then also there is that kind of, there's also good times to kind of move forward and have more of an intense or immersive experience. But I think it's just best to honor our own boundaries wherever we are. We could have had a really hectic week or been sick last week, and it might be best to do less, right? And pull back.
Mm-hmm.
And there are times where it's valuable to kind of have a more transformational type experience. But in general, the cadence of dosing, so that's a little different as well than it is from classic psychedelics. We tend to see the best outcomes with ketamine in a series of doses. We don't really see like this huge bang for its buck with one dose. In fact, most people statistically don't really even notice a huge benefit or a detectable benefit until somewhere between dose 3 to 6 with like our oral dosing. So there's a little bit of patience involved. And sometimes that just takes a little bit of time as well to kind of
Mm-hmm.
get its mechanism of action kind of working. And that kind of brings me to like the cadence of dosing. So this is obviously determined with the provider and the client, what makes the most sense and based on symptoms. In general, though, we would dose typically once weekly and sometimes up to twice weekly, depending on the severity of symptoms. But this doesn't go on forever. Like ketamine's not intended to be a medication we just take endlessly. It's intended to be kind of an episodic or kind of a series of time that we use it. And then we may kind of rest it for a while or break or holiday from it. And then there may be times where we return to it. But I think that initially in those first, like I'd say 6 to 10 doses,
Mm-hmm.
most people are dosing weekly or perhaps twice a week. And then we also start to see in maintenance that we're able to kind of move that cadence out a bit. So we might be dosing every 2 weeks. We might be dosing once a month and still be able to kind of tap into that place where
Mm-hmm.
we're more plastic and more adaptable.
Mm-hmm.
And
Yeah.
I think you've already kind of talked about all the other important things, but maybe you'd be great to kind of review like the other types of things that really help. Because it isn't just ketamine, right? We could take ketamine
Mm-hmm.
and feel better and then nothing would change or
Mm-hmm.
we would go back to our
Mm-hmm.
baseline. So we have to kind of include something that's helping with change
Yeah.
agency. And that can be so many things, right?
Yeah, I actually like that it is not in one session that all your life changes.
Yeah.
Because, like, even though in some of other psychedelics, you may
Yeah.
feel like, okay, got that ceremony, and normally it's at least 2 or 3 in a row that you
Yeah.
feel this full transformation. And then there is a risk of like going home and just you feel transformed, and then slowly
Yeah.
everything wears off because you go back to what
Yeah.
you were doing before instead of changing.
Yeah.
And that happens often, and then people come back to squares one. So the fact that ketamine is itself already, it's already made that you need to take into consideration that it is a process
Yeah.
of at least 1 month or more to 1 month and a half, in which you also work with a coach and therapy, so a therapist. So the integration part is already in,
Mm.
like, woven together with a treatment. That makes it more prone to success, to
Yeah.
really make the changes in your life. And yeah, so that's actually beautiful, because it's already like you need to do your work as well as taking
Yeah. They kind of beget each
ketamine.
other. Yeah. They encourage each other, right? But I
Yes.
think you're right. And I think you tap on exactly the concept of like synaptic pruning. So, like, when we think about something, we're improving we make this new little neural connection, right? And there's this old saying that, like, is one of my favorites. Thank you, Jen. That neurons that fire together wire together, right? So, when
Hmm.
things are firing at the same time, they wire together and they hardwire. But there's also this concept of like synaptic pruning. So, like, we develop a new thing. It's like learning a language. You learn it
Hmm.
and you never use it. Your brain will eventually just start snipping it away and be like, you're not using that. We're going to clip that away. It's not useful. It's not resourceful. We're just going to get rid of it. So we have to use these things in order to
Hmm.
kind of reinforce this neural pairing and the
Hmm.
neural network that's forming. And we do that exactly in that way over time and with
Hmm.
adjunctive treatments, right? So psychotherapy or coaching
Yeah.
or personal growth and development and our perhaps our spiritual practices, but also some of the other things we include in our self-care. We have to kind of practice. It's like that analogy, right? Like, nobody starts off as an Olympic athlete. They
Hmm.
start training, right? So we have
Practice.
to kind of keep
Hmm.
practicing. Exactly. And I think that's that
Yeah.
reiteration that really does kind of solidify those neural networks. And
Yeah.
that's where we see lasting change, right? Like, we see like ongoing change agency. And I think that's the difference for sure.
Hmm. Yeah, and that's relate again to what you say there. It's not one miracle pill, it's a tool in a toolbox, but at the same time, it's like everything in life. If
Yeah.
we look at the big picture, as you just like talk about, like athlete and so on, that's like everything works for a human being. At least it's like, okay, you learn something new, and then
Yeah.
you need to practice. Not only
Yeah.
practice make perfect, but also practice make it like incorporated into your own being and your own life. And that's whatever you take in life, that's how
Yeah.
as a human being life works, period.
Exactly. Exactly. You're right. Like, it just is. Like, it's just facts. So, and I think we sometimes miss that. And I would never speak bad about any psychedelic or psychotherapeutic community, but I think this is sometimes why when we've had folks that have been in, talk therapy for, 15 years or so, and they're not really getting anywhere. It's because validating and like seeing someone's emotions and feelings and all that is so useful and very therapeutic. but sometimes we have to like stretch a new muscle and like practice it before we can
Hmm.
get it to engage differently. And I think that's
Hmm.
what we see with, some of the other therapeutic modalities like EMDR. Sidebar, I think that if EMDR and ketamine got married and had a baby, like the whole world would change. Like those two together are just mind-blowingly wonderful. So I love
So,
their potential.
what is that?
So EMDR is like the eye movement, desensitization and reprocessing. So it's a modality that most people have thought of it as like the light bar, like where you follow it with your eyes. So it
Yeah,
moves
yeah.
across the corpus callosum in the brain. And in doing so, it almost neutralizes kind of a lot of trauma, or, traumatic or impactful memories that can be kind of stuck. I've used this work personally, and I can tell you, like, absolutely game changing. But paired together, we found that in some communities, clinicians that are using EMDR with patients that are undergoing ketamine treatment are getting even more synergistic outcomes. Like they're moving through trauma faster. They're moving through it like
Oh.
20 to 30% faster processing.
Mm.
So it's a really an effective way of like reprocessing trauma and or
Hmm.
difficulties and et cetera, reactions, responses, wired neurons, and repairing them with new ketamine treatments to reinforce new neural networks. So just really remarkable stuff that's out there. And I can't wait to see like studies that include like some of these newer treatment modalities, like, and even in conjunction with each other. But really fascinating stuff. But I agree, to come to your point, like we have to kind of practice these things to reinforce
Yes.
them, to get them to become more automatic for us and to become new templates that we're able to utilize.
Hmm.
Otherwise, it's just something we learned once that is no longer like present or valuable, accessible.
Yeah. And again, everything like not only all the other plant medicine, but even like I was thinking when we were talking, like yoga. If you
Hmm.
just do your yoga practice and then you don't take what you feel or what you learn listening to your guru or what you learn during a ceremony, if you don't take it out in the world, there is
Yeah.
no change. And
Yes.
that's what is encouraged,
Yeah.
not only in harmoniously, but also like that with ketamine as it is, as it is this way that you need to incorporate, like you have to, otherwise the treatment is already has this length. So
Yes.
you are like forced to
Hmm.
integrate while you're doing it. So
Yeah.
that's a good way, but hopefully everyone will incorporate integration in these tools
Yeah.
anyway, even if doing any other kind of modalities, of course.
Yes.
But it's
Yeah.
so important that I think it was Ramdas saying that if you feel you're enlightened, spend a week with your family.
Right.
And
Yeah.
for example,
Absolutely.
yeah, and also like some Sadhguru
Hmm.
says many times like your sadhana is a spiritual practice. Your
Yeah.
sadhana is everything, like any
Yeah.
person that talks to you, whatever it's anything
Yeah.
during your days is your sadhana, is your spiritual
Yeah.
practice, which means like a
Yes.
tool for self-development and self-growth.
Yes.
Everything needs to become, as you were saying before, about integration of all your parts of yourself,
Yeah.
integration of all of these lessons in life around you, so
Yeah.
that becomes reality.
Yeah. Because our spiritual practices, right, they can be working in the garden. Like they aren't
Yes.
always prayer and ritual. They can
Hmm.
be, there's ceremony in all of it, right? There can be,
Yes.
I think, in gardening or time in nature. Or I feed my crows every morning, and like that's a very spiritual practice for me, right? It's part of my spiritual work. So I think, and I think that's a beautiful concept, right? Because it doesn't have to look one way. And
Hmm.
I think you and I are talking a lot about this spiritual concept, right? And this may be like French to someone else, right? Like they may not be interested in achieving, exploring any kind of spirituality. And that's okay too, right? Because I think a lot of people want to alleviate their symptoms or feel better and be able to engage
Hmm.
in their lives. Some people do want to be able to explore the realm of spirituality and I think the stretch of consciousness. So I don't think there's any wrong or right to that, right? Like what I mean to say is like there's space for all of it to exist in here, and I think especially in a
Yeah.
psychedelic space, I think there's space for all of it.
Hmm. Yeah, I think in short, everyone just want to enjoy life, feel better,
Yeah,
and be a better
yeah,
person. in a
Definitely.
better world.
Yeah, and create a better world, right? Yeah, because I think that's what we're doing. Like the better we are, the better world we create. And
Hmm.
I absolutely agree. But I think that kind of summarizes at least like the neurobiological benefits and obviously the kind of treatment overview for most patients. Um, what else did I miss, Mel? Do you have any questions?
No, I think it's pretty much it. So
Okay.
we discussed what's ketamine,
Yeah.
um, who's for,
Yeah.
how's the treatment, how it
Mhm.
works. I
Yeah.
think that's it. That's all.
Spent a little time with ketamine, you and I today. So yeah, I agree. I could go on and on about this topic forever. So sometimes people have to stop me
I'm
because I'll just start
sure.
nerding out about it and like down this rabbit hole of all these beautiful
Hmm.
analogies, and I'll start quoting everyone. But I do love to talk about it, and I love spending time in this space. And I truly love being a part of this journey. And I always kind of imagine it as just being like a lantern on a path. I'm not guiding anyone anywhere, right? I'm not. You're your own guide, so I don't need to guide you. But
Hmm.
I'm here to offer a lantern on that path if you like it, if you need a little light, you want to look at something on the ground. But I do think harmoniously we have so many different ways to kind of meet you where you are with,
Hmm.
from a medical lens as well as from, spiritual lens and even nutrition lenses and psychotherapy lenses. So we kind of have, I think we're trying to create a bigger community to kind of serve that N of one, which I always kind of describe as like the study of one. Like what works for you is what works for you, right? And it may be very different for everyone else. So there's kind of space to have all of that. And hopefully we're representing that a little bit better here at Harmoniously.
I love the study of one.
Yeah, me too. Me too. Most important one.
Yes, that's beautiful. I think we can conclude with that, the study of one.
I love it. I
So thank
agree.
you everyone for watching, listening. And then if you have any questions, just reach out, comment, and we can do other podcasts as well on more specific themes that comes out from this more generic
Yeah.
episode about like ketamine in general, or any other topic that's
Yeah.
anything we're doing harmoniously. So thank you everyone. Thank you,
Thank you.
Rachel.
Thank you, Mal.